Hi everyone, I am Rosalind Anita, nursing tutor in Tribhuvan College of Nursing. Today I am going to present the topic of embalming. Objectives: Introduction, definition of embalming, effects of embalming, methods of preservation, methods of embalming, enlist the chemicals and fluids for preservation, advantages of embalming, disadvantages of embalming, conclusion and references. Introduction. Embalming is the art and science of preserving human remains by treating them in its modern form with chemicals to forestall decomposition. This is usually done to make the deceased suitable for public or private viewing as a part of the funeral ceremony or keep them preserved for medical purposes in an anatomical laboratory. Considered one of the humankind's longest practiced arts, the Egyptian originated embalming around 3200 BC because they believed religious resurrection could only occur for bodies. Definition: Embalming is a process of chemically treating the dead human body to reduce the presence and growth of microorganisms, to retard decomposition, and to restore on acceptable physical appearances. Frederick and Straub, 1959. Effects of embalming: alters the appearance of the body, tissues, and organs, making it difficult to interrupt any injury or disease. Proteins are coagulated, tissues are fixed, organs are bleached and hardened, blood converted into brownish mass. It is completely destroyed, cyanide, alcohol, and many other substances. Determination of presence of many other alkaloids and organic poisons become very difficult. Blood grouping cannot be done. Thrombi and emboli will be dislocated and washed away. Produces a chemical stiffening similar to rigor mortis, and normal rigor does not develop. Embalming rigidity is permanent. This is an embalming laboratory. Methods of preservation: natural means, freezing, ice, snow, glaciers, dry cold, cold dry air, dry heat, dry warm air. Artificial means, simple heat, powder, evisceration and immersion, evisceration, local insertion and immersion, evisceration and drying, simple immersion, arterial injection and evisceration, cavity injection and immersion, arterial injection and cavity treatment, artificial cold. Methods of embalming: arterial embalming, cavity embalming, hypodermic embalming, surface embalming. Arterial embalming: an L-shaped cannula is then inserted into the carotid artery via the slit and tied securely with a string. The other end of the L-shaped cannula is connected to polyethylene tubing, which is connected to the gravity embalming tank located above the calf. Before embalming, fluid is injected. Air is removed from the connecting tube to avoid any possible airlocks produced by the vessel of the cadaver during the injection of the fluid. Injection periods vary in each case, taking 8 to 24 hours. This variability is due to the ability of the body to accept the fluid at its own rate. This is arterial embalming. Instruments and container containing the embalming fluids. Cavity embalming. Cavity embalming refers to the replacement of internal fluids inside body cavities with embalming chemicals via the use of an aspirator and trocar. The embalmer makes a small incision just above the navel, 2 inches superior and 2 inches to the right, and pushes the trocar in the chest and stomach cavities to puncture the hollow organ and their contents. The cavities are filled with the concentrated chemicals that contain formaldehyde. Hypodermic embalming. Hypodermic embalming is a supplemental method. It is referred to the injection of embalming chemicals into tissue with the hypodermic needle and syringe, which is generally used as a needle on the case by the case basis to treat the areas where arterial fluid has not been successfully distributed during the main arterial injection. Surface embalming. Surface embalming is another supplemental method. The local body areas are preserved by applying suitable chemicals to surface of the body. Maybe the arterial or cavity fluid, pack of cotton or gauze or soaked applied to the internal skin. Example: the burn tissue, bed sore, surface lesions. Coming to the chemicals and fluids, preservatives, germicides, buffers, wetting agent, anticoagulant, dyes, vehicle and perfuming agent. Types of preservatives: formaldehyde, methanol, phenol. Formaldehyde, discovered in 1856 by the British chemist August Wilhelm von Hofmann. It is a colorless, pungent odor, commercially available as formalin containing 37% of formaldehyde in water, 7% of methyl alcohol. Coming to the methanol, volatile, inflammable and poisonous. It is if consumed causes blindness and death. Best preservative that precipitates protein and kills many organisms. Best useful dilution is 75% isopropyl alcohol, penetrates and diffuses easily. Phenol, carbonic acid, coal tar derivatives, extremely poisonous, colorless, crystalline solids. Light exposure turns dark. Rapidly absorbed by protein contents of tissues, non-soluble in water, soluble in ether, ethanol, chloroform and glycerin. Coming to the germicides, surface disinfectants, kill microbes. Example, phenolic derivatives, zafarin chloride, glutaraldehyde. Coming to the buffers, weak acids or base salts are used to stabilize the pH called buffers. Stability of the chemicals in embalming depends on the pH of the medium. Example, the sodium borate, sodium bicarbonate, magnesium carbonate, sodium carbonate. Wetting agents lowers the high surface tension of the water and facilitates penetration and distribution of embalming fluids. Example, glycerin, glycol, sorbitol, sodium lauryl sulfate. Coming to the anticoagulants, used to precipitate the calcium to non-ionized salt. They maintain blood in the liquid state and facilitate removal of blood and distribution of arterial fluids. Example, the sodium citrate, sodium oxalate. Dyes produce an internal cosmetic effects that stimulate the natural coloring of the tissue. Example, tetrabromofluorescein, procune, ethrosine, amaranth, abdel, funsine, toluene, red and rhodamine. Vehicles, dilutants or solvents or a mixture of solvents helps the ingredients in solution in a stable and uniform state transport through vascular system to the different part of the body. Example, alcohols, glycerin, sorbitol, water. Perfumes, masking agents, water soluble or made soluble by surfactants. They are floral components. Example, methyl salicylate, clove oil, xenon oil of peppermints or lavender. Coming to the muscle relaxants, relax smooth muscles in arterial wall and assist flow of fluid in vascular system. Example, the magnesium chloride. Coming to the disinfections, disinfection agent used to inamidate by destroying the microbial agent but not the bacterial spores. Sterilization, that is effective, decontaminates completely. Embalming the fluids, arterial fluids, cavity fluids, pre-injection fluids. Arterial fluids, preservatives, formalin 10%, methanol 55%, buffers, sodium borate 15 gram, anticoagulant, sodium citrate 15 gram, wetting agent, glycerin 20%, germicide, phenol 5%, vehicle water 10%, fungicide, thymol few crystallites, dye 1% using 5 ml, perfumes, wintergreen oil 10 ml. Cavity fluids, fluids injected into body cavity, that is the thoracic, abdominal, pelvic cavities with a trocar. For an average body, about 2 liters of cavity fluids is injected. Preserves and disinfects the wall and parenchyma of organs, contents of hollow viscera and space between the visceral organs. Cavity fluid composition, formalin 60%, methanol 25%, glycerin 2.5%, phenol 10% and mercury chloride 1%, lavender 1%. Pre-injection fluids. Pre-injection fluids is injected before injecting the arterial fluids. It allows to drain the blood from vascular system. 4 to 5 liters injected, wait for 30 minutes before injecting the arterial fluids. Loosen the clots, improve the drainages, contain the anticoagulants and buffers. Fluids used in dissection laboratory, pain mixture for keeping moist, glycerin 75%, alcohol 10%, phenol 5%, water 10%. Advantages: specimen made available for dissection within a 40 8 to 72 hours. Widely used for preparation of specimen for dissections. Suitable method for long time preservation of the cadaver organ of tissues. Coming to the disadvantages, formalin emballed specimen are moist to touch, emit toxic vapors, and need glove to handle them. The formalin is an irritant to eye and nasal mucosa. The natural color of the fixed specimen is altered, and large size specimen are difficult to be handled. So, if the specimen jar is kept open, formalin gets evaporated. The specimen may get dried up and there is a formation of formic acid salts which stains brown color to the jar. Frequent replacement of the solution every 3 to 4 months is required. Conclusions: familiar should know their option for what will work best for the deceased. It helps them in their grieving process and give a proper send off. Preparing a list of things required post one's death will be helpful to your family members or how to execute the necessary things. References: Embalming Principles and Legal Aspects and Andrew and Hot, www.http embalming script and www.http embalming the slide share. Thank you.